Hi, everybody. Welcome to the CoronaSphere Lounge. I'm your host, Bill Whittle. Yet another perfect start to a highly produced program. Our engineering staff deserves an enormous hand. Bravo, guys. It's tough for you to get this thing off the ground, and I know the work that goes into it I just got nothing to say, but thank all of you guys, the entire engineering staff, 25, 25 people. This is a CoronaSphere Lounge today, and guys, I just want you to know, I mean this from the bottom of my heart. I would rather work with you than with the best people in the business. I mean that. Anyway, here we go. So, simple one today. Let's review. Brace yourselves. Here comes phase two. Um, phase two, I'm going to just decide is going back to work, and it's time to brace ourselves. Not because of what's going to happen with the virus, although I'll talk about that a little bit. Uh, Brace yourselves because of the assault that's going to begin. Texas goes back to work on Monday morning, at least to some degree. Uh, Scott Ott, who's our guinea pig in Texas, has said that his furniture store is going to reopen at 25% capacity, and then they'll start to reopen more and more and more. So when I say brace yourselves, I'm going to continue to do my very best to do the job that the media has not done for you and refuses to. When Texas goes back to work on Monday, 4 or 5 days after that, the number of COVID-19 cases are going to increase, and they're going to increase somewhat dramatically. They're not going to increase exponentially. I don't think that's possible. In fact, I know it's not possible. But they're going to increase. And since the number of cases will increase, the number of deaths will increase also. Not anything like what we were seeing at the beginning of this back in March, but it's going to happen. And when I say brace yourself for what's coming because the media is going to take every single case, every single death that happens after Monday is going to be blamed directly on President Trump and his love of money and the conservatives and the Texans and all the rest of it are endangering the country and there it goes. You know, takes 14 days to get sick. I've heard that's closer to the outside limit. I've heard it's less than can be some as little as 5. Whatever the amount is, prepare for it. There's going to be an increase in number of cases, and that means an increase in number of deaths. And they're going to howl and scream like this is uh, murder. That's what they're going to call it. Blood on his hands. Dr. Fauci said we should have stayed locked down for, well, Dr. Fauci thinks we should stay locked down until June of next year or whatever the time is. It's not his job to worry about the economy. His job is to save every life possible. And as I've said before, he's right. We save a lot more lives if we stayed locked down, but we can't, so we won't. So brace yourselves for what this news media and what these politicians are going to do. Um, they are going to inflame this, and they are going to do everything in their power to convince you that Texas has caught fire. Uh, they'll do their best, but the good news is, and continues to be, and the only reason we're in the fight, the only reason that the conservative movement exists at all, is that while the media can create the message and influence a lot of people's minds, they cannot actually write reality. Uh, and so, since they cannot write reality, excuse me, oh, sorry, uh, since they can't write reality, um, reality is going to write them. Uh, the purpose of flattening the curve, as I've said, is to prevent any given time more cases than our medical system can handle. There's plenty of evidence. We talked about this on the last CoronaSphere Lounge that we've not only flattened the curve, we've cratered it. We've actually put it to the point where hospitals are going out of business because they don't have enough people. So now it's time to let some air out of the balloon and put some people back to work. And what Texas is doing, I think, is sound and overdue. It's overdue. Um, Kern County, California, as we talked about on our last episode, the Dr. Erickson and his group of clinics up there has caught enormous flack because he said that his clinics, he didn't say in the world, he admitted that New York has taken a pasting and all the rest of it. But he said in Kern County, in his clinics, they've had to lay off doctors and nurses because there's not enough patients. And during that last show, we had a number of people check in the comment section anecdotally saying, yeah, I broke my wrist, broke my shoulder, went to the emergency room, it's empty. Am I saying that every emergency room is empty? No. Am I saying this whole thing was imaginary? Certainly not. And I'm not saying it's the flu either. But what I am saying is, if they're sending nurses and doctors home in Kern County, then Kern County has waited too long to send people back to work under some limited circumstances. The perfect, uh, the perfect solution would have been for hospitals to be operating not at maximum capacity, but at a comfortably high capacity, normal capacity. In other words, we do enough social distancing to take the other cases out of there so that the hospitals could work normal shifts, doing nothing but treating COVID-19 plus whatever else they needed to make up the difference. The fact that we have not had the medical system saturate is one. This is the thing no one's talking about that I have seen yet. We have succeeded spectacularly, astonishingly. We have succeeded astonishingly. We have saved tens of thousands, if not hundreds of thousands of American lives, and that was worth doing. But now it's time to go back to work. And and what is going to happen is the media and the politicians, the Democratic politicians, are going to do everything in their power to keep people terrified and do everything in their power to convince them that this is a terrible, terrible, terrible mistake. Brace yourselves. That's coming. Um, and they will isolate cases. They will use examples. Here's a healthy young guy in Texas. He just dropped dead from COVID-19, and it's coming. It's coming. So you have to brace yourself against the onslaught of the fear mongering that's going to happen on the part of the media. I want to stress this again because I've been taken out of context before and I want to be taken out of context again. This is not a joke and it's not unserious, but the social distancing and the tremendous wreckage that we've done to our economy saved a lot of lives, more lives than we possibly could have expected. We not only didn't saturate the medical system, in some cases we've basically put it out of business. So it's time to go back. Um, and the other piece of extremely good news is that as we continue to test, we find more and more people who are positive for COVID-19 but asymptomatic, didn't even know they had it, or maybe they had what they thought was a little touch of the flu back in December. Turns out, no, that was it. Um, the thing to remember as we get into this period of ramped up hysteria is very simple. Flattening the curve did not mean not getting infected. Flattening the curve never meant that we were going to go into our tornado shelter. COVID 19 was going to pass over us like the angel of death, at which point it would be gone behind us. And at that point, we would be safe and we could come back up again. That was never, ever, ever a possibility with a highly contagious airborne virus. That was never a possibility. The entire purpose was to keep the rates of infection low enough so that we could deal with them, and we have done that spectacularly. So, what I think is coming is this: we're going to see Texas going back to work. Scott Ott as our mobile guinea pig, and what Nebraska Furniture Mart, which is located in Texas, nationwide chain that Scott works for, he's going to start again on Monday. They say they're going to limit the capacity of the store to 25%. This seems reasonable to me. I'm sure people will be coming in masks, maybe not all of them. I'm sure some people will continue to wear gloves, maybe not all of them. People are going to wash their hands more often than they did before this happened, no question about that. And so we will start to see infections increasing, recoveries increasing, and to some degree deaths increasing. One of the things that these doctors, Dr. Erickson pointed out, was got nothing to do with his case or the statistics or anything else. He just said, never in history have we done this. We have always quarantined sick people, but we've never quarantined the healthy before. And that's exactly what we did. Um, so we so we managed to get through that. Uh, Now, in terms of testing and tracking, a lot of people are asking questions about this. Uh, One of my big realizations on the second half of this curve as opposed to the front half when I was learning so much about virology and diseases and so on. Um, but as we start to get into the political world, we realize that all of the proclamations made in March have no impact anymore. The data is too old. The changes have been too dramatic, and all of this um, forecasts that were made in March have no bearing on reality today. So one of the problems that we were dealing with in the beginning of this was was testing, and one of the things that we talked about, that I talked about, was immunity, even if it's a relatively short-term immunity. Um, so okay, so isolation has been for sick people, not quarantine. Isolation has been for the sick, but we've isolated the healthy. So it's still a relative. It's still kind of an unknown. But when we were talking about testing and we were talking about immunity and letting people go back to work and so on, we talked a lot about how would you prove it, and do you have to wear a bracelet? And then people were saying, well, why not just wear a yellow star, and all the rest of it. But what the sense I get, and again, that's basically what I do. Um, we uh, we seem to be dealing with this on a almost on a personal level and on a common sense level. So, first of all, the common sense level uh, is that we're is that the federalist system is working. Texas is going back to work before New York is, and I suspect the entire country will go back to work before New York does. In fact, I think New York State will go back to work before the five boroughs do. Um, we are gonna we are gonna see the cases increase. We're gonna see the recoveries increase, and I suspect that this thing will end with a whimper. If I had to guess, that's what I would say. I would say that you will never know the point at which it ended. We remember when it began. I remember that March, was it March 29th? We were doing the Stratosphere Lounge right here, and somebody said, "You, Gavin Newsom, just shut your state down." So all of those stay-at-home protocols happen within the space of several days. But I suspect that in the end, um, we are going to see pretty much the opposite. That we will never we will we will never be able to put a finger on when it ended. We'll just know that it did. It's like the Cold War. Um, Somebody in the comments says the press won't let it end. That's just not true. If it was true, we'd be doomed, but it's not true. We had a big heat wave here in California a week ago, and the beaches were largely full. Um, and this is California, land of the sheep. Um, Turns out not so sheepish. They just went to the beach. They knew they weren't allowed to, but they went anyway. And that's when Governor Newsom pleaded with them to stay home. And that's when you knew that this is not, uh, no matter how much they wanted it to be a power grab, if there's no teeth behind it, um, then it's not a power grab. Mao said that power comes from the barrel of a gun. He's absolutely right. If this lockdown was not enforced by arrests, then it's a request, no matter how they word it. And that's why I've tolerated it. Um, the we have saved a lot of American lives, and I'm glad that we did it. And now it's time for us to go back and slowly. Gavin Newsom shut down Orange County beaches. They said that day in question they were open, and look, some of the evidence is irreducible. We deal with things like models, and we don't know the infection rate because we don't know how many people have it and all the rest of it. We don't know what the mortality rate is, all of it. But what I can tell you is this. um, I can tell you that the day after that order, and for the first 2 3 weeks after that order, this parking lot was deserted in this building. And there's more cars in the parking lot every day. There's more cars on the road in California every day. It's just ending. um, and to me, this seems like the way to do it. And the reason I say that, if you think about it, is if you basically leave people to their own devices, then you're going to have a spectrum of release. And the spectrum of release is also going to be appropriate. Let me tell you what I mean by that. If the lockdown orders continue, or the media hysteria continues, there will be some people who either think that this whole thing was completely overblown, or who say, I'm in a low risk group, I might as well just go out there now. And if it turns out that I'm going to get infected sooner or later, might as well do it now. I'm 30 years old, I'm healthy, I stand essentially zero risk of dying from this. And so if you basically leave people to their own devices, what you're going to find is that the first people to go back to work and ease off the social restrictions, ease off the masks, ease off the gloves, the people that do that first are going to be the people who are the boldest people. It doesn't necessarily mean the smartest people, but it means the boldest people. The other end of the spectrum is that the people who are most afraid for their lives, the people who are in terror of this, are going to be shouting at the windows from the people who are outside, and they're going to be wishing they die a horrible, slow death, like that woman did on that video. But basically, the more scared you are, the less willing you will be to go out and reduce the social distancing. But I don't see anybody thinking that on Monday you go out and start looking doorknobs again. I think that what we're going to see is that I think we're going to see something really sensible. I think people are going to peer outside the cave. There were lions out there, and we could hear them. We saw some dead bodies. Nobody knows how many lions. Some people said it was just one, and it wasn't even a lion. It was a bobcat. Other people say no, there's an entire pride of lions. There's 2,000 of them out there. We don't know. We know somebody's been killed. A couple people have been killed. So now we put our head outside the cave and we look around. And those people who are the most courageous and the most brave will go out there first, and they'll go out there further. And if it turns out that there are thousands of lions out there, then those people will be probably preyed upon first, and everybody else will duck back inside. There will be people in the back of the cave who will be convinced that they're out there no matter what evidence there are, and is just convinced that those people are just out there and the lion's just waiting to jump on them. And those people have a right to stay home. And the reason I find this to be such an appropriate and American and sensible attitude is that no one should be put out of their comfort zone any longer. What I mean by that is, I think you still have an obligation to not spread the virus. To me, that means masks for a while and see how this whole thing goes. But um, people people should be allowed to come back in their comfort zone. And I think, and I maintain, that humans, Americans anyway, have a very good ability to judge ambient risks, no matter what the press says about us. And the reason the press doesn't give us any good news is because, number one, it makes Orange Man look good, and that's not allowed. They need the panic, they need the hysteria, and they need the economy cratered. But put that aside for a minute. Ultimately, the press doesn't report on any good news, like hydroxychloroquine or any of the rest of it. They don't report it because they're convinced that we're children, and they're convinced that if they give us good news, we're all just going to go out and start shooting our guns in the air, and licking doorknobs. That's what they think of us. And the reason they think that of us is because that's who they are themselves. They're scared and they're irresponsible and they're childish. And they don't want to die. And they don't want and if that means having everybody else stay home, what do they care? They're journalists and they're working. Same goes for billionaires and so on. So uh, I was late with the show today because I was on a conference call to a bunch of people in Texas who needed some cheering up. So let me just go over some of the points I made with them. Um, this whole thing is a matter of perspective. We are facing a psychological problem now, not so much a biological problem. The biological threat is there, and I'm not denying that. But we are basically in a phase now where we have to start adjusting our psychology. And the best way to think about this is this. There is now a new way to die. It wasn't here before. It's new and it's real. Now there's a way to die that we didn't have before, and that is through infection called COVID-19. It has killed significant numbers of people. The exact number we don't know. We don't know whether they died of it or with it. But when you look at the people who were on the front lines in New York and you listen to their stories, it is not a joke. It's a new way to die. And we can thank the Communist Party of China for that. And not only is it a new way to die, it's the gift that keeps on giving. It will never go away. It's a new virus. It will continue to replicate until we figure out a way to defeat viruses permanently. Then it's here, and it's with us, and it's a new way for people to die. As time goes on, the threat that it poses will get smaller. More people will have recovered, have temporary immunity. The vaccine will come at some point or another. New antiviral medicines will come at some point or another. We'll get better at treating it, but it's here forever. You just have to face that. But but what you have to do as well, and this is the important thing, this is the critical thing. All the news media has talked about is death, death, death. There are two things that you need to do. And if there's anything that you can take out of this entire series, please take this out. Okay, this is the most important thing. If you look at deaths in America as a bar graph, here's COVID-19. It's a new bar graph. There are excess deaths in the country now because of this virus. There's no question about that, in my opinion, none. That sucks. That's bad. Put the economic stuff aside for a minute. I'm talking about recovery. I'm talking about post lockdown America. Now there's a new bar, and here's a number of people. Is it 5,000? Is it 50,000? Who knows? Here's a number of people that are going to die from COVID-19 that would not have died before because there was no COVID-19 before. Now, what I want you to remember is two important things. The first important thing is no one has shown us how big that bar is in comparison to all the other bars that we've been living with for our entire lives. So no one has put that bar in perspective. If we count the number of people that have died of COVID-19 since January 1st of 2020, how many people have died of diabetes? How many people have died of car accidents? How many people have died of cancer? How many people have died of heart disease? We accept all of that. Um, all of that. I'll get to that in a minute. Um, so we we are we accept the fact. All of us accept the fact. Let's go back to before this thing happened. Let's go back to December 31st of 1999 of 2019. You could go back to December 31st of 1999 if you want to too. Let's just go back to pre-pandemic days. When you got up in the morning and when you went outside, you did this subconsciously, but you've done it every day of your life. You have left your house and you have accepted the risks involved with being alive. You have gotten comfortable with the ambient risk. You know there's a chance of being killed in a car accident, but you get in your car anyway because the chance is really pretty small. You know there's a chance that your child could be kidnapped and murdered. You know there's a chance it could be a school shooting. You know there's a chance that any number of things could happen to you. Something could fall off a building. You could slip in a bathtub. And we've got these numbers to a very high degree of precision, and they're pretty constant. So if you look at leading causes of death prior to this year, they would list in order, and we know that. And when I say you're ready to accept the ambient risk, we know that that the somebody's saying we're getting some static from the audio. I can't do anything about that. I'm sorry. Uh, I can't. Um, so uh, I can unplug it and plug it in. We try that if you'd like. That may break the cycle of static infection, or it may end up killing the show. I'm going to live with it. I'll worry about it later. So stay with me here. when you go out for dinner, right? If you go out and have spare ribs and mashed potatoes with butter and gravy, you're increasing your chance of dying. And you know this. You know it. You know it and you accept it. Um, and that's what I mean by ambient risk. You know that when you get on an airplane, what you don't know, what you think you know is wrong. What you don't know is when you get on an airplane, you're safer than you would be if you continue to drive your car. But nevertheless, there's a risk, all of it. But think about the little things. When you have an extra Coke or an extra candy bar, you're increasing your chance of type 2 diabetes. And you accept that risk because you are aware of it. We are now going to have a new element in the ambient risk that we have to face every year, and it is going to become part of the background noise. It'll be just part uh, of the flu-like symptoms. It may double the number of flu deaths. Maybe it'll triple it. Nobody knows. I'm not saying that. What I am saying is we will accept it and we'll move on. So the first thing of the two things that you need to come out of this show with are this. There's a new way to die, but what does this new way to die look like compared to the other ways of dying that we've grown up with? That's number one. Much, much more importantly is this. Here's COVID-19. It's a new way to die. Yellow fever, which used to be up to the ceiling, gone. Smallpox, up to the ceiling, gone. Traffic accidents, every year, smaller and smaller and smaller and smaller and smaller. Cancer deaths every year, smaller and smaller and smaller and smaller and smaller. We have technologies like stents and and angioplasty, and the number of people who die from coronary surgery continues to go down every year. Every year, the other bars, the COVID-19 bar is here, but every year, all of those other bars, which we've grown up with our entire lives, get smaller and smaller and smaller and smaller and smaller. So we just simply have to accept this. It would be nice if the number of ways to die continued to go down forever. But given the total numbers of death from this so far and the total numbers of death that we are likely to see, it is not, we should be thankful, and we should be thankful every day uh, that we have done um, what we can, and that that life does not owe us a world where it gets less and less likely to die every single year. That's a result of medicine. That's a result of human ingenuity. Human ingenuity continues. This is going to be a tremendous spur to to antiviral medications and so on. But this is my point. Even though we have to increase our ambient risk level because of COVID-19 going forward, we also increase it in a world where every single one of these other things continues to decline, and COVID-19 death and risk will decline too. Once we get to a vaccine, once we get to better understanding of these virals and so on, and they become standardized treatments despite what the press says and so on. Um, so uh, that's really about it. When I say brace yourselves, when the news media starts bleating about how Texas went back to work too early, Texas will have gone back to work too early and too quickly if Texas has patients on gurneys in the hallway of their hospitals. And anything less than that is inevitable. Do we understand that? Flattening the curve means keeping it underneath the ability of our medical profession to handle, the medical facilities to handle. If we do not see gurneys in the hallway and people dying outside in the emergency room, and there are no hospital beds, Then Texas went back to work too fast. But I don't think we're going to see that. Um, and deaths from this will continue, just like deaths from heart disease and everything else. And it will be, for the foreseeable future, significantly more fatal than the flu. If the virus does not mutate as quickly as the flu does, and that seems to be the case, then a vaccine will significantly reduce the number of new deaths if you decide to take the vaccine, and so on. And ultimately, when it's all done, um, what we can expect to see now is a transition from basically, look, the self-quarantine was a fire break. For those of you not familiar with that term, if you've got a wildfire, and especially here in California where there's so much dry brush and it's burning like wildfire, that means you've got a flame and you've got lots and lots and lots of fuel. And the more fuel you have, the faster that fire is going to burn, and the denser the fuel is pushed together, the faster and the more intense it's going to burn. So herd immunity means that these dry branches become filled with water and they won't burn. But what we've done, what we just did, was not herd immunity, it was a fire break. We basically went way ahead of where the fire is, and we cut a huge open swath, and we just cut down all of this fuel, all of this dried bushes, just cut them down. Let's say it was a mile, it was never a mile wide, but let's just say it was. We cut all of this stuff down, and when the fire got to that point, it no longer has that densely packed fuel. It can't burn its way across there. It will send embers up, and the embers will travel with the wind, and they will land on the other side of the fire break, and they will start fires again. But those probably can be contained in a way that the wildfire could not be contained. That's basically the best I can do in terms of trying to explain what we've been through and what we have to see. If we've done this as well as we've done everything else, then we will not see the explosive growth curve because we're not going to go back to the behaviors that we had all at once. Furniture Mart isn't opening up to 100% capacity. They're opening up to 25% capacity. They're, and on and on and on we go. So that's about it. Why do I see James Redmond's? Huh. Anyway, um, he's a terrific guy. So just the last thing about tracking and so on. If by tracking they mean case tracking, you have tested positive for COVID-19. Who do you know? Who did you talk to? That horse has left the barn. That ship has sailed a long time ago. That's just that strategy is effective if you can jump on it at the beginning of an outbreak. But that ship's gone. And if you're talking about tracking to the degree that the government is keeping track of your health status or anything, that is a bigger threat than COVID-19 ever will be. Americans aren't going to put up with that either. So um, the sense I'm getting is that people are going to let themselves out of quarantine as they see fit. That this stay-at-home order never had real teeth behind it. That they couldn't arrest all of us. That the beaches in California were filled because people wanted to go to the beach and they knew they couldn't arrest everybody. Um, and when it's all said and done, I think I feel confident. I feel virtually certain. In fact, I cannot imagine a world where the total number of casualties, we get to the end of 2020 and December 31st of 2020, we will not have seen 2 million Americans dead from COVID-19. I don't know what the number will be, but it won't be that. It will be, I think, on the low end of the revised predictions. It may even be below the low end of the revised predictions. That's all due to what we did voluntarily. We should be exceedingly proud of what we did. And now it's time to go back to work carefully, the way we've done everything is carefully. And I like the idea of individuals being able to determine how much risk they want to take, because that's what we do anyway. There are people who will go for rides in aerobatic airplanes. There are people who will go, um, uh, who will go skydiving. There will people who will bungee jump. There are people who will go surfing. There are people who will take more risks than others because they're comfortable with risks. Turns out that the people who are more comfortable with risks are younger people. In this particular case, younger people are least at risk. That's good. That's good. If they want to be the first ones out, great. We now know the basics on how to protect ourselves to some degree, and we are not going to instantly go back to the behaviors that we had on March 1st or whatever the case may be. So I think it's going to be fine. Anyway, that'll do it for this edition, but prepare yourself for the media onslaught that is coming. Once people start to go back to work, it is inevitable that the number of cases will increase. That's the plan. But prepare yourselves for the endless bleating that it was much too soon, that it's virtually murder, that we have to go back and just prepare yourself. Keep it in perspective. Remember the bar compared to the other bars, and remember that life gets safer every day. That's about it. So that'll do it for this edition of the CoronaSphere Lounge, made possible by the paying members at BillWhittle.com, for whom we are exceedingly grateful, as always. And in this time, especially, as Scott's pointed out many times, uh, uh, we've seen a big influx of new members, and that's not only due to the addition of the new shows. It's also got a lot to do with people appreciating free flow of information in times when information is being tightly rationed and controlled by people who are not as smart as you are and who are far more scared than you are. Um, and it's only because of the internet that we have done as well with this as we can and kept our sanity and kept our freedom too. We are going to be fine. We took a hit, uh, and we're going to continue to take some hits. And I mean for some payback for that. But we handled it. Last thing I'll tell you that I told the group I just got off of, for those people who are convinced that we're just a bunch of cowards and sheep and we just obediently did this like we've somehow lost our national character, our national will, I would just give you something to think about. Far more civilians have died from COVID-19 than civilians died in World War II. American civilians, I'm talking about. Far more. Far more. In World War II, we were willing to ration gasoline, rubber, food. We haven't had to do any of that. In World War II, we were willing to do whatever it took. Uh, Women went to work who'd never been to work before. There was a draft. People bought war bonds. They took their hard-earned money and voluntarily put it into war bonds. We did what we had to do because Nazi Germany and Imperial Japan had to be defeated. And nobody put a gun to anybody's head. And nobody said either you buy a war bond or we're going to blow your brains out. Nobody was executed for violating rationing laws. They didn't do it. Americans did that in World War II because there was an external existential threat to this country, and Americans came together to save each other's lives and did what we needed to do. And when it was over, we went back. And when this is over, we'll go back too. If this was a political power play, this would be a very different show. But it wasn't. It was an act. It was an external act that happened. And I am incredibly proud of the American people. Not so proud of the politicians, with one prominent exception. And I think the media needs to be destroyed, as we understand it, needs to be destroyed. It's not only not telling the truth, it's not even hiding, it's not even covering up stories anymore. It is simply a weapon of the enemies of these people, of the American people. It's filled with cowards and people with no morals and no courage and no values other than their own narcissism and their desire for power and their desire to look good. They're miserable, rotten, horrible people, and they don't deserve the title of journalists. They are They're agitators. They're they're cowards. They're weenies. I don't mean that to sound trivializing. That's what they are. They're just a bunch of self-centered, terrified weenies who think they're smarter than everybody else, but they're not. They're just the worst people out there. And this has shown us even more clearly than that. But we're not, though. We're awesome folks because we have a common sense and decency. That's what we sell here. And we owe all of that to the members of BillWhittle.com who continue to pay for these programs so that other people can see them free. That'll do it for this edition of the CoronaSphere Lounge. Another episode as soon as there's something, significant enough to talk about. I'm sure that will happen sometime soon. Sorry about the Stratosphere Lounge tonight, but I could only do one or the other, and so we did this one. And I'm sure we will see you next week here for the Stratosphere Lounge, and we'll certainly see you tomorrow morning for the latest Bill Whittle Now and Right Angles. We'll see you next week. We'll be here. We're not going anywhere. You're not going anywhere either. And last thing I'll say is what I said earlier to the group in Texas. Dr. Fauci um, said that we should never shake hands again. He's speaking as an epidemiologist and a guy who doesn't strike me as shaking hands a whole lot to begin with. Dr. Fauci is getting a lot of flack that I don't think he deserves, but he never struck me as a guy with a firm handshake. But I'll tell you one thing. We're going to be shaking hands again on the 4th of July because I'm not going to live in a country where you don't get to shake hands with people. I'm not going to live in a country where we bump elbows. Just not going to do it. And I don't think you will either. And no matter how much um, they want us to, they won't be able to pull it off because we're braver than they are. We're smarter too. So, been a pleasure. Been a pleasure being locked down with you. Let's see what happens. Let's be as smart as we can, and most of all, let's be as reactive as we can to changing data, which is something we have not been seeing out there. All right, thanks for joining us. It's been great, and we will see you next time right here on the CoronaSphere Lounge.